morning everyone from Cypress Grove Homestead. So today we're doing a quick video just to tell you a little bit about one of the vaccines that we use here on the farm and also when we give it to the goats. So this one right here is called CD&T and it's to help prevent what's called overeating disease. Sorry, Snickerdoodle's in the background trying to kill me. It prevents what's called Clostridium, if I'm pronouncing it right, Clostridium varieties C and D, and also tetanus. That's what the T is, so C, D, and T. And it's an injection that you give when they're babies. You give the first one whenever they're 3 months old. Then you give the booster shot when they're you give the first one when they're 1 month old. You give the booster shot when they're 2 months old, and then they're good for the first year. And then every year thereafter, for the rest of their life, you give them a yearly booster shot. The only time that varies is whenever they're pregnant. Whenever they're pregnant, like Ginger here, you give them a booster shot 30 days before they give birth. That gives the vaccine time to get into their bloodstream and pass over through the placenta into the babies. Because what that will do is it makes sure that the babies are covered for the first 30 days of their life. Which is why, whenever I was telling you when you give the vaccines, you don't give the babies the vaccine for the first 30 days, you give them at the 1 month mark and the 2 month marks. And since Ginger is going to be giving birth in about 30 days, it's time to give her the vaccine. The good thing about this vaccine is it's not based on weight, it's just always a flat 2 cc's or 2 milliliters of the vaccine. So I've got it prepped here. Always 2, doesn't matter if they're this big, little babies, always 2 milliliters. And it's under the skin, so what you always do is, I'm going to go ahead and describe it now because whenever I get to doing it, I'm not going to have time to do this. But you'll pinch up the skin someplace loose, which on Ginger's going to be tough today because she is, right back here I think is going to be the best because she's still got some skin here. You pull it up because you don't want to go into the muscle. And I'll put the needle in the tent of skin that I make by pulling up on the skin. And then once it's in there, I'll pull back the plunger just to make sure I don't have any blood, because if I have blood, that means I'm into a vein or an artery. If I do, then I would pull it back and put it someplace else. But if I pull back and I don't have any blood, that means that I'm just under the skin and there's no blood, so it's fine to push it in. And that's just an easy way to make sure that you're not in any artery or vein. That's just very critical, because if you're giving antibiotics or things like that, if you inject the antibiotic right into the bloodstream, it could really be dangerous for the goat, sometimes even fatal. With this, I don't think it's that big of a deal, but we just like to practice the same precautionary methods with all of our vaccines and medicines. So that's that, and then what you'll do is then you pull it back out and just rub it for a little bit just to, make it more comfortable for them. I've got my little alcohol prep pad here, which is basically just the paper towel that I use to wipe Binky's udders, and I always wipe it with alcohol for that, so I've got some alcohol in here, and I'll actually put a little bit more on. Because we want the area to be clean, so I found this area back here will work on Ginger. So I rub it real good.
And do you want to put some cookies in there as a distraction?
Yep.
We always try to distract the goats so that they don't really know what's going on until it's over.
Because they're like dinosaurs when it comes to their brains and being able to focus on one thing. If their brains are focusing on food, the signal from the pain will be like interrupted for at least a couple seconds. That hopefully will give me time to get in and get out.
Right.
So I'm going to dump these in here. And here we go.
And there she goes.
So I put this down. You always tap it, make sure all the air bubbles are out, and give it a little squirt at the top to make sure you get all the air bubbles out. Ginger, you get back. So I pinch up the skin, like I said. Don, you want to come this way so you can see?
I got you.
I poke it in.
She noticed.
I pull back the plunger.
Right.
No blood.
Good.
Squeeze it in. Press like that. Pull it out. And just press so that it mitigates the pain.
And Ginger is up here still eating as if nothing happened.
Ginger's eating her cookies, and then this will have 30 days to get into her bloodstream, go all through, cross over, and so that way for the first 30 days of their lives, the babies will be protected against any kind of, through the antibodies in Ginger's milk. And I put that cap down here.
All right.
Then we recap it like this.
Yep.
And then Ginger was such a good girl that she gets some more cookies. Yeah, Hi, Ginge.
We're gonna treat her for pre-diabetes soon.
Right. Then we'll be so good at giving shots that whenever it comes time for insulin, it won't matter.
Right. All right. That's all from here.
And then we let her go, and you're all good. You're good for another year.
There you go. Good job.
So that's it. That's how we give our goats almost all of their shots, whether it's antibiotics, if they ever get sick, which we don't like to give them antibiotics unless it's a last case scenario. But mostly it's for like their yearly vaccines. And like you can see, it's very little trauma to her. She only slightly knew what was going on and was minorly inconvenienced. And she's like, cookies, okay, I can deal with this.
Right,
So
exactly.
that's all going on this morning, the big highlight of our day. So back to the routine.